In this class, we are going to see details about muscles of the back region. So, to know about the muscles of back region, we will dissect from the superficial part, then we will go to deeper area. So, superficially in back region, you will see skin. Then after you removing skin, you will see superficial fascia. After that, you will see deep fascia. Later to deep fascia, you will be getting into this part, that is muscles of back region, and these muscles again will be divided into two layers, such as superficial layer of muscles and deep layer of muscles. So now we are going to orient how the muscles are arranged, and then we will go on to the details of these muscles, about its origin, insertion, nerve supply and its action. Now how it is oriented alone we are going to see. So in this image you can make out a first muscle which is present after removing the skin and superficial fascia along with deep fascia. So we will be having a muscle which is diamond in shape. Can you make out this muscle? So which is diamond in shape if both the sides are united. So that muscle is nothing but trapezius muscle. So this trapezius muscle, now we are going to see about one side of the muscle. So this is trapezius, right? This trapezius muscle is the first muscle you will look into when we dissect the deep fascia and remove it. So we will be having trapezius muscle which is triangular in outline if you take from one side. So this is trapezius muscle. If you make out, this is the origin of trapezius muscle. So this will be considered as origin, that is from the medial aspect. From the medial aspect we will be having origin of this trapezius muscle, and this muscle, it is converging together in the lateral aspect and getting inserted into three bones laterally. That is, first some fibers are going anteriorly, that is getting and inserting into clavicle, and some fibers, that is middle fibers, are going into deltoid tubercle of humerus, and some posterior fibers are going into scapula. So these are the insertion of trapezius. About the details we will deal later. Now you just remember origin is from medial aspect, that is from the nuchal line, and also spinous process of vertebrae, it is going to take origin. Then after it is inserting by passing laterally by three fibers. One is for anterior fibers which is getting inserted into clavicle, and other middle fibers getting inserted into humerus, and posterior fibers getting inserted into scapula. That's all about the details of trapezius you have to know. So it is triangular in shape. Now we are going to see the details about latissimus dorsi. So after trapezius, in superficial layer we are having another muscle which is present below the trapezius muscle, that is nothing but latissimus dorsi. This latissimus dorsi also somewhat triangular in shape, and here you can consider this as apex, and this will be called as base of the latissimus dorsi. And this muscle also having origin taking from medial aspect and the insertion happening in the lateral aspect. So origin of this latissimus dorsi, it is from thoracic spines along with lumbar and sacral vertebra, and also from iliac crest, and some fibers will be taking origin from scapula part also. Later all these muscle fibers are getting converged together and getting inserted into the humerus region. So it is getting inserted in the humerus part. In the humerus we will be having a sulcus, and that sulcus will be having a floor. So floor of the intertubercular sulcus of humerus will be giving the insertion for this latissimus dorsi. So this is the latissimus dorsi. Origin taking from medial aspect, and also some fibers from scapula's lower part, later inserting into the intertubercular sulcus of humerus. Floor of the intertubercular sulcus of humerus will be getting insertion. That's all about this latissimus dorsi you have to know. So in superficial layer of back muscles, above we have trapezius, below we will be having latissimus dorsi. The muscle which you are seeing here is latissimus dorsi. Now we will move on to the deep layer below this trapezius and latissimus dorsi. So if you see the deeper layer, we will be having many muscles present. Okay, so for that we have to dissect these two muscles. So first we will dissect trapezius muscle. So once you remove this trapezius muscle, you can make out some muscles present just below it. That is nothing but one will be called as rhomboides minor, another will be called as rhomboides major, and above these two muscles we will be having another muscle present that we will call as levator scapulae. So just below the trapezius muscle, in the deeper layer, we have three muscles from above downwards. One is levator scapulae, and below that we will be having rhomboides minor, and below that we will be having rhomboides major. So these are the three muscles we are going to see now. So about levator scapulae, it is again called as a strap muscle, and it is going to take origin from the transverse process of the upper forecervical vertebra. Here also it is going to take origin from medial aspect. Then after it is going and getting inserted into the spinous process of scapula's angle region. So spinous process of scapula will be happening present here. This will be called as angle of the spinous process. So this or apex of the spinous process. So from the above part of apex of the spinous process of scapula, we will be having insertion of this levator scapulae. If you talk about rhomboides minor, this again taking origin from medial aspect, that is from the vertebrae. Later it is getting inserted into the correct point of the apex of the spinous process. So above this apex of spinous process, we will be having insertion of levator scapulae. At the point of apex of the spinous process, we will be having insertion of rhomboides minor, and below we will be having a larger area in scapula, right? So that area is giving insertion for rhomboides major muscle. So these are the three muscles which will be seen just below the trapezius muscle: rhomboides minor, rhomboides major, and above these two muscles we have levator scapulae. So after that, if you see lateral part, these will be seen in the medial aspect. Now you see lateral aspect, you can make out other muscles present in the dorsal aspect of scapular region. That is, we will be having somewhat spinous process in this point. Okay, so just above the spinous process we will be having a fossa called supraspinous fossa. So that fossa is giving origin for a muscle called supraspinatus. So the muscle which you are seeing is supraspinatus muscle. So talking about this muscle, it is going to take origin from that fossa of scapula, and then it is getting inserted laterally by getting attached to the greater tubercle. So in humerus we have greater tubercle. That greater tubercle again will be having three impressions: upper, middle and lower impression. So in the lateral part, so in the upper impression of greater tubercle we will be having insertion of this supraspinatus muscle, and below that we have another muscle called infraspinatus muscle. Name itself it indicates, same like supraspinatus, it is present just below the spinous process. So we are calling that as infraspinatus muscle, and it is also going to take origin from infraspinous fossa. Later it is getting inserted into the middle impression of greater tubercle. In upper impression supraspinatus, in middle impression we have infraspinatus. Just below that you can make out another muscle also seen. That muscle is nothing but again we call as teres major, and just above the teres major you can make out another muscle, that is teres minor. So teres minor and teres major will be seen. Teres minor will be taking origin from the again dorsal aspect of the lateral border of scapula, and then it is getting inserted into the lowest impression of the greater tubercle. As I said, greater tubercle we are dividing into three impression: above, middle and lower impression. Above for supraspinatus, middle for infraspinatus, and the lowermost for teres minor. If you talk about teres major, it is going to take origin from again lower aspect of the dorsal part of lateral border of scapula, and then it is getting inserted into the humerus again, but in the medial lip of intertubercular sulcus. So in humerus we having a feature called intertubercular sulcus. That again will be having medial lip and lateral lip, which we dealt earlier. So in medial lip we will be having insertion of the teres major. In lateral lip we have pectoralis major insertion. So that's all about the muscles you have to now know for now. Okay, so we have first muscle as trapezius and latissimus dorsi. Then we have levator scapulae, rhomboidus minor, rhomboidus major, and then we will be having supraspinatus, infraspinatus, and then teres minor along with teres major. And if you remove again, so we can remove these muscles. Okay, so once you remove supraspinatus and infraspinatus, you can make out a bony part here that is also removed. So here we are seeing only muscles part. So now if you see, we'll be having one thickened muscle which you can make out here. That muscle is nothing but subscapularis, which is a muscle seen in the anterior aspect of the scapula. So subscapular fossa we will call. From the subscapular fossa we will be having origin of the subscapularis muscle, and this is again taking origin from scapula and getting inserted into humerus. So about the scapular muscles, these are the things you have to remember about trapezius, latissimus dorsi, and how it is oriented. And below the trapezius we have levator scapulae, rhomboidus minor and rhomboidus major, and then we will be having again supraspinatus, infraspinatus, and below that in the ventral aspect we will be having subscapularis muscle. Then we will be having rhomboidus minor and rhomboidus major muscle also seen in the lateral border. Okay, so these all about the details of scapular muscles seen in the body. So now we will go on to the detailed description of these muscles, how it is taking origin and how it is getting inserted, about its nerve supply and action also. So now we are going to get into the detailed description of trapezius and scapular muscles. So to get into these muscles, origin, insertion and all, first you have to know a thorough knowledge about osteopath, that is about clavicle, scapula and all. We will brush up some details about those bones now. So now taking about clavicle. So in clavicle, the first picture what they shown is superior surface. So superior surface of clavicle is shown here. So this is considered as anterior and this one will be posterior. And here in superior surface you can make out muscle called trapezius muscle, so which is seen in the posterior border of the upper surface. So posterior border, near to the upper surface we have muscle called trapezius, which is getting inserted. The blue color demarcation is indicating the muscle insertion. So trapezius muscle inserting in the posterior border of the superior surface of clavicle in its lateral 1/3. You know, we will divide clavicle into two parts. One is medial 2/3, another one is lateral 1/3. So in lateral 1/3, superior surface, posterior border, we have trapezius muscle. Then if we are talking about this is inferior surface. Inferior surface, again the muscle which we are going to deal in this part is subclavius muscle, and subclavius muscle and trapezoid ligaments and all you have to remember. And about the detailed description of all these structures we will deal later. Now for our purpose, you remember trapezius muscle insertion, and this is clavicle part, medial 2/3 and lateral 1/3. This is superior surface and this is called as inferior surface, and with its attachment it is given in this picture. All these attachments we will deal later again according to the regions. And here the green color demarcation what they shown is about ligament attachment, and red color is for originations, and the blue color is for muscle insertion. Now we are going to deal with this trapezius muscle. And now we will go into details of scapula. So this is a scapula. We are going to brush up the details. So scapula anterior surface is shown here. In anterior surface you can make out a fossa in the anterior part. That fossa we will call as subscapular fossa. You know, it is a fossa which is going to give attachment for subscapularis muscle. And here the anterior surface of scapula is otherwise known as costal surface because it is related close to the costal ribs. And then here we have borders such as medial border, and this is lateral border, and this will be superior border. And here some processes and all you can see. One is acromion process here, and this whole thing is spinous process which is going to continue as acromion process. and below that you will be having another process which we will call as coracoid process because of crow's beak like appearance. So this is coracoid, this is acromion, which is a continuation of spinous process, and this is costal surface. And here what you are seeing is dorsal surface, that is posterior surface. In posterior surface the process is clear, that is spinous process, which is going to continue as acromion process, and above the spinous process the fossa what you are seeing is supraspinous fossa. The upper part of spinous process will be having some depression, and that fossa is called as supraspinous fossa. And here in second picture you can make out below the spinous process another depressed area, and that area is called as infraspinous fossa. And that's all about the details of osteopart of scapula. Now we will move on to another bone called humerus, which is a bone seen in arm region. So here in first picture what you are seeing is head of humerus. Okay, and then here what you are seeing is in second picture a tubercle in the shaft of the humerus that we will call as deltoid tuberosity. And then in third picture what you are seeing is lesser tubercle. You can make out near to the head you will be having one larger impression, and that we will call as greater tubercle, and here we will be having lesser tubercle. And in this picture between the greater and lesser tubercle you will see a groove. That groove is called as bicipital groove, and otherwise known as intertubercular sulcus. That's all about the details of osteopart. Now we will get into a muscular region. So scapular muscles we are going to deal, and as I said before we are going to see superficial muscles of back region, and superficial muscle again we will divide into first layer and second layer. And first layer muscle are trapezius and latissimus dorsi, and once you remove the trapezius muscle you will see levator scapulae, rhomboides minor, rhomboides major. So these are the muscles seen in the back region. And scapular muscles are subscapularis, supraspinatus, infraspinatus, teres minor and teres major. So these all are superficial muscle, and these are deeper muscles. So superficial muscle 5 in number, trapezius, latissimus dorsi, and below that we will be having levator scapulae, rhomboides minor, rhomboides major from above downwards. And again deeper muscles which we will call as scapular muscles, and that again 5 in number. One is subscapularis, and another is supraspinatus, infraspinatus, and teres minor along with teres major. Now we will get into details of trapezius muscle. So if you can make out here a diamond shaped muscle you can see. Okay, this is a normal human body. In this you can make out some diamond shaped area that is nothing but formed by trapezius muscle. And here in this picture dissected image you can make out one half of a muscle. That half is nothing but trapezius muscle, which is triangular in shape. So this is trapezius muscle. Now about the origin of trapezius. The red color demarcated area will indicate the origin. You have to trace it off as I am telling. So first one, it is taking origin from medial 1/3 of superior nuchal line of occipital bone. So this is called as occipital bone. This whole thing is occipital bone. In this you will be having superior nuchal line, and that nuchal line's medial 1/3 is giving attachment first. Then after we will be having one ligament in the neck region we will call as ligamentum nuchae. That is also giving some attachment for this muscle. Along with that, spinous process of all thoracic vertebra, that is all 12 thoracic vertebra are giving attachment for this trapezius muscle. So origin from 3 areas. One is from superior nuchal line of occipital bone, that is only medial 1/3. Then we have attachment getting arise from ligamentum nuchae, and then it is from spinous process of all the thoracic vertebra. And this all about the origin of trapezius. Now coming to insertion, as I said before, so from medial it is taking origin and getting inserted into the lateral part. In lateral part, if you see, we will be dividing into upper fibers, middle fibers and lower fibers. Upper fibers going to the clavicle, and middle fibers going to the acromion process, and lower fibers will be going to the deltoid tubercle. You can make out here. So here in scapular region we will be having upper lip of the crest of spine of scapula, that is also giving attachment for this trapezius muscle along with the acromion process. So above scapular attachment, it is happening in the upper lip of crest of scapula along with acromion process. And then we will be having attachment seen in clavicle, that is in the lateral superior surface, lateral 1/3 superior surface of clavicle, giving attachment for this trapezius muscle. And other attachment is in deltoid tubercle. And now coming for its nerve supply, it is supplied by spinal accessory nerve, that is cranial nerve. We have 12 in number. Among the 12 cranial nerve, we have 11th cranial nerve as spinal accessory nerve. So spinal accessory nerve, it is going to supply the trapezius muscle. Now we will deal with its action. So action of this trapezius muscle are upper fibers, lower fibers and middle fibers we are dividing for its action. And upper fibers is going to elevate, and middle fibers it is going to retract the scapula, and lower fibers is for depressing. So we have elevation, depression and retraction as actions of this trapezius by its corresponding fibers, that is upper, middle and lower. Upper for elevation, lower for depression, middle is for retraction of scapula. So in cadaver it will be seen in such a way. So this is trapezius muscle which you will view in cadavers. You can make out the outline clearly. So this is one half of the trapezius muscle. Same way another half will be seen on another side. Then this is the outline. Okay, now we will move on to next muscle, that is latissimus dorsi. So latissimus dorsi, it is again a muscle seen in superficial layer, and it is the first layer muscle just below the trapezius muscle. You can make out trapezius here. Just below the trapezius we have another muscle called latissimus dorsi, which is also somewhat triangular in shape. Origin of this latissimus dorsi is from below uppers we are going, that is from the outer lip of iliac crest. This will be iliac crest, from the outer lip of iliac crest and thoracolumbar fascia, and also from lower 6 thoracic spines. So lower 6 thoracic spines also giving attachment, and here we will be having lower 3 to 4 ribs also giving attachment for this latissimus dorsi along with inferior angle of scapula. So origin by means of 5 cases, that is from iliac crest, thoracolumbar fascia, and then from lower 6 thoracic spines along with lower 3rd to 4th ribs and inferior angle of scapula. These are about the origin of latissimus dorsi. Now we will see the insertion. The insertion, it is going laterally as I said before. So medially it is taking origin and going laterally for its insertion. Insertion into the floor of bicipital groove. You might be remembering where bicipital groove is present. So in humerus, near to the neck region of the humerus, we have a groove called bicipital groove. So in the floor of bicipital groove we will be having insertion of this latissimus dorsi muscle. So you can make out clearly in this picture, that is latissimus dorsi. And then we will move on to its origin and insertion image. So here you can see the origin of this latissimus dorsi which we dealt now. So this all the spines which is giving attachment, that is thoracic spine along with lumbar vertebra giving attachment for latissimus dorsi posteriorly, and from the sides it is getting attachment from the lower 3 to 4 ribs. And then we will be having insertion happening in the humerus, that is in the bicipital groove. And the origin, another more origin what you are seeing here is from the inferior angle of scapula. So here you can make out a cadaveric picture. So in cadaver you will see latissimus dorsi in this view. Okay, so now we will go on to nerve supply and its action. Nerve supply of latissimus dorsi is same. It is nerve to latissimus dorsi, and it is carrying fibers from C6, C7 and C8 spinal nerves. The action of latissimus dorsi are, it is going to extend, adduct and medially rotate the humerus, and also it raises body towards arm during climbing action. So it is going to form actions such as extension, adduction and medial rotation of humerus, and it is also going to raise the body towards the arm during the climbing action. That's all about the details of latissimus dorsi. So we have seen two muscles, that is trapezius and latissimus dorsi, which is the first layer superficial muscles in back region. So scapular muscles, we are going to deal about the second layer. So here you can make out, so this muscle as levator scapulae. So this is scapula. From the scapula, from above downwards, we have levator scapulae, and then, so this is levator scapulae, then we will be having rhomboides minor and major. This is rhomboides minor and this is rhomboides major. So about second layer scapular muscles, these are the three muscles we are going to deal now. Now we will see about levator scapulae. So levator scapulae, as I said, it is a muscle which is going to elevate the scapula. So it is named as levator scapulae. The origin of this muscle is from transverse process of C1 to C4. You can make out here. So these are the transverse process of cervical vertebrae present, and from the C1 to C4 transverse process, it is going to take origin, and then it is getting inserted into the superior angle and medial border of the scapula. So laterally it is coming downwards and then getting inserted into the superior angle and medial border of scapula, that is above the apex of the spinous process. We have the attachment of levator scapulae. The nerve supply of this muscle is by dorsal scapular nerve, which we seen in brachial plexus, that is carrying C5 nerve fiber, and also from C3 and C4 nerves also. So nerve fiber C3, C4 and C5 nerve fibers are contributing for the supply of levator scapulae. And then the action of this muscle, as I said, it is going to elevate the scapula, and also it tilts its glenoid cavity inferiorly by rotating scapula. So these are the two functions caused by levator scapulae. One is elevation of scapula and another one is it is going to tilt its glenoid cavity inferiorly by rotating the scapula. And then now we will deal with another two muscle, that is rhomboides minor and major muscle. About rhomboides minor, here you can make out, so this is rhomboides minor. The origin of rhomboides minor is from C7 to T1, spinous process of C7 to T1. It is going to give origin for rhomboides minor. Insertion of this muscle is happening in the medial border of scapula near the apex of the scapular spine. You can make out here clearly. So origin from C7 and T1 as spinous process of these two thoracic vertebra, insertion in the medial border of scapula near the apex of the scapular spine. And now we are going to move to other details of rhomboides major. So rhomboides major, it is taking origin from T2 to T5 spinous process. So T2 to T5 spinous process giving origin for rhomboides major, and these are going to get inserted into inferior angle to the root of the scapular spine. This whole thing is insertion of rhomboides major. So rhomboides major inserting from the root of scapular spine to the inferior angle, and that is why we are calling this as rhomboides major and this as rhomboides minor, because of its extended insertion, and this is having a smaller insertion. And for nerve supply of these two muscles, it is by dorsal scapular nerve, that is carrying C5 spinal fibers. Now we have action. Both the muscles are going to retract the scapula and fix the scapula to the thoracic wall. So both the muscles are acting together by retracting the scapula and also by fixing the scapula close to the thoracic wall. Now we will move on to details of two important topics, that is triangle of auscultation and lumbar triangle of Petit, which is again important questions for your exam purpose for practical and theory part. Now we will move on to its details. So here in this image you can make out triangle of auscultation present here. I think you people can view this properly. This is triangle which is going to be called as triangle of auscultation. It is a triangular area as you can see, and it is related close to the chest wall, and it is going to have boundaries below formed by horizontal border of latissimus dorsi. You know, here we have a muscle called latissimus dorsi that is going to form the lower boundary, and then we will be having medial boundary that is formed by lateral border of trapezius muscle. So this whole thing is trapezius muscle, lateral border of trapezius going to form the medial boundary for this triangle of auscultation, and lateral boundary for this triangle of auscultation is formed by the vertebral border of scapula, that is some part of rhomboidus major also will be related. So three boundaries you have to make out. One is lateral boundary, medial boundary, and the inferior boundary. Inferior boundary formed by latissimus dorsi, medial boundary formed by trapezius, and the lateral boundary formed by vertebral border of scapula along with rhomboidus major muscle. Why it is very important? This is a triangle where we have cardiac orifice of stomach, and why it is deepened here, which is not seen in other parts. It is made because of the 6th and 7th rib will be related in this region, and between these two ribs we will be having one space called intercostal space, and that space is not covered by muscle posteriorly, which is causing this depression. So this depression, it is used clinically during if they are using stethoscope, sometimes they will hear splash of swallowed liquids during esophageal obstruction. So in that condition it is very useful. This triangle of auscultation, it is used during the esophageal obstruction. That time they will hear a splash of swallowed liquids. Okay, so if they keep stethoscope at this region, they can hear that sound, and by that they can understand it is an esophageal obstruction. And near to this region we have a relation called cardiac orifice of stomach. So that's all about the details of triangle of auscultation. You have to remember, you have to tell about the boundaries and how it is formed because of the intercostal space between 6th and 7th rib, and what is the clinical importance. Now we will move on to another important triangle, that is lumbar triangle or triangle of Petit. So this is a triangle which is seen in the lower part, and this is situated above the iliac crest. You can make out here, this is iliac crest, and just above the iliac crest we have this lumbar triangle, and it is bounded again in front by the posterior border of external oblique. You can make out here. So this is posterior border of external oblique, and behind by lateral border of latissimus dorsi. So this is latissimus dorsi. So behind it is bounded by lateral border of latissimus dorsi. And base, you know, it is formed by iliac crest. The bony part you can see here. So base is formed by iliac crest. So boundaries of lumbar triangle: anteriorly by the external oblique, posteriorly by latissimus dorsi, and below base is formed by iliac crest. Apex, it is formed by convergence of external oblique and latissimus dorsi. So external oblique and latissimus dorsi converging together to form the apex of lumbar triangle. And this triangle is clinically weaker triangle or weaker area in the abdominal wall. So because of that, some herniation may occur from this space. So as this is weaker area, herniation is more prone in this space. So that's all about the details of triangle of auscultation and lumbar triangle of Petit, you have to remember. Now we will move on to deeper layer muscle. So first muscle what we are going to see is subscapularis. So you can make out an image here. So bones they have shown, that is scapula and humerus articulated bone. So in scapula, anterior surface is shown here. In anterior surface, the red color demarcation is showing subscapular fossa. So from this fossa, origination is happening. So origin from subscapular fossa, insertion into the humerus, that is in the lesser tubercle of humerus. So we have lesser tubercle which is giving insertion for this subscapularis muscle. So you can make out muscle here clearly. So this is a cadaveric specimen where you can see subscapularis muscle on the whole of the anterior surface of scapula. So nerve supply of this muscle is by upper and lower subscapular nerves, and also action if you are taking, it is going to cause medial rotation and adduction of the shoulder joint. So medial rotation along with adduction of shoulder joint is happened by this subscapularis muscle. Now we will move on to next muscle, that is supraspinatus, which is present in the posterior surface of the scapula. Above the spinous process, we have a fossa that we will call as supraspinous fossa, that is going to give origin for this supraspinatus muscle. So this is supraspinous fossa giving origin for supraspinatus. Insertion in the greater tubercle, as I said before, the upper impression of greater tubercle of humerus is going to give insertion for this supraspinatus. And here you can make out clearly the origin and insertion, and then the next image, nerve supply. So nerve supply of the supraspinatus is by suprascapular nerve, which is going to carry C5 and C6 spinal nerves. The action of this muscle is it is going to initiate and also going to assist deltoid in abduction of arm. So to do abduction of the arm, it is going to initiate, and also it is going to assist deltoid muscle during this action. So initiation of abduction is formed by supraspinatus muscle, and it is going to help deltoid muscle to do this action better. Now we will move into another muscle, that is infraspinatus and teres minor, which is also deep layer muscle. So infraspinatus muscle, that is present below the spinous process here. So this muscle is infraspinatus, where it is taking origin from infraspinous fossa of scapula, and it is getting inserted into the middle impression of greater tubercle of humerus. So now coming to teres minor, it is again taking origin from dorsal surface of lateral border of scapula. So this is lateral border and this is medial border. Lateral borders upper two-third. So upper two-third of lateral border of dorsal surface, it is giving origin for teres minor, and it is getting inserted into the lowest impression on greater tubercle of humerus. Here you have to remember, like sit muscles, greater tubercle, it is giving insertion for sit muscles from above downwards. Upper impression for supraspinatus, middle impression for infraspinatus, and lowermost impression is for teres minor. So sit muscles you can remember. For insertion of these three muscles, it is happening in greater tubercle. Origin also, it is very simple. From the posterior surface, above the spinous process, supraspinatus muscle, below the spinous process, infraspinatus muscle, and from the lateral two-third of the posterior aspect of lateral border, we have origin of teres minor muscle. That's all about the details of these muscles. So here you can make out clearly supraspinatus, infraspinatus along with teres minor muscle. The nerve supply of infraspinatus is suprascapular nerve, which is going to carry C5 and C6 nerve fibers. Teres minor, it is supplied by axillary nerve, which is also carrying C5 and C6. The action of these two muscles are, it is going to laterally rotate the arm. So action for these two muscles will be same, that is lateral rotation of arm. Now we will move on to details of teres major. So teres major, it is taking origin from lower one-third of lateral border of scapula. So teres minor we studied above, that is lateral two-third, and here lateral one-third. Okay, so lower one-third of lateral border of scapula giving origin for teres major, and this is going to insert in the intertubercular sulcus medial lip. Medial lip of intertubercular sulcus or bicipital groove giving insertion for this teres major muscle. The nerve supply for this is lower subscapular nerve, and action will be adduction and medial rotation of the arm. So where we studied like for teres minor it is lateral rotation, here it is opposite, it is going to adduct and medially rotate the arm. And these are the recap about whatever we seen now. The muscles you can make out: trapezius, latissimus dorsi, levator scapulae, and rhomboides minor along with rhomboides major. And here we have teres major. And here the same muscle what we see now, teres major muscle, they have shown clearly. And here these are the deep muscles what we are seeing, and this one is supraspinatus, infraspinatus along with teres minor. And this is anterior view. In anterior view we will be having subscapularis muscle, and this is about deltoid muscle, which we will deal later. And that's all about scapular muscles such as trapezius and all other important muscles you have to remember. It is a very simple topic. Try to orient in your body, then it will be easier for you to remember. Thank you for listening.